Case 1 is a patient presenting with a soft tissue mass palpable in the lateral aspect of the right thigh. An MRI had been ordered by the referring provider. The technologist had noted the palpable lump and placed markers flanking the proximal and distal end. So this is the first of the vitamin E markers that were placed. Proximally, the mass is located somewhere in this vicinity up to the distal marker here. And so if we look on this T1 weighted non-contrast enhanced image, we don't see any sort of aggressive appearing non-fatty mass within the superficial tissues here, nor within the underlying muscles. And just to briefly review what I discussed in the introductory video in terms of superficial versus deep. So masses that are located superficial to the investing fascia that sits on top of the muscle here, all the way up to the skin, this would be the superficial area for mass in the subcutaneous plane. And then anything deep to the fascia within this compartment all the way down to the bone would be considered a deep mass. So on this T1 weighted image, really no obvious non-fatty mass seen, although if you look really carefully in that area that the technologist pointed out, there may be a small little bulge of the soft tissues, little tiny septations and vessels running through, but other than that, not much to say. We'll switch to a T2 weighted fat suppressed image, and in that same area, the subcutaneous adipose tissue all the way around suppresses, and all the tissues in between the markers suppress too, so we again don't see a mass in this area aside from maybe some mild bulging contour there. Now if we switch to the ultrasound and we look in the area of the palpable abnormality, no vascularity here is what they're showing, but let's go to the diagnostic ultrasound here, and you can see there is a hyperechoic oval-shaped mass that we're starting to see relative to the subcutaneous adipose tissue. So we've got skin here, subcutaneous adipose tissue, and we're getting down towards the fascia. We'll see a little bit better in a little bit. And now you can really see that circumscribed oval-shaped hyperechoic mass right here in the area of the palpable abnormality. The technologist has measured it. It's about 2.1 centimeters in long axis, and then we zoomed out a little bit. Now you can really see that mass here well within the subcutaneous plane down to the fascia here, and then the underlying muscles here. So with ultrasound, you have a small hyperechoic superficial mass that is superficial to the fascia. It is uniform in echogenicity with no vascularity. Statistically, by ultrasound, this is most consistent with a lipoma, and then with the MRI, that clinches the diagnosis. It is comprised of completely normal appearing macroscopic fat with no nodularity, thick septations, myxomatous elements. So this is a superficial lipoma of the thigh.